Did you know that you're supposed to live 120 years? Yet most people in the U.S. die in their 60s, 70s, and 80s. Welcome to Longevity with Dr. Wilcox. For the next 60 minutes, we're going to add years to your life. The phone lines are open at 731-1230. That's 731-1230. Or toll free. 1-866-820-5528. That's 1-866-820-KLAV. Now, let's bring on the host. Here is Dr. Simmon Wilcox.
Good morning. We're back here at the top of the hour and the top of the new year. Today we're going to be talking with Ken Baker, our resident scientist and researcher. He's going to talk about type 1A diabetes and type 3 diabetes. Just a new concept we want to educate our listeners about. Good morning, Ken.
Good morning.
And in addition to that, just before we allow Ken to help elaborate on type 1A diabetes and type 3 diabetes, and we all heard of type 1 and type 2, but we want to take you to another level this morning. I just want to come full circle with what we talked about on the last show. When we talked about the having 4 to 9 pounds of bacteria in our guts, that we try to bring you to a level where you understood that it was important to micromanage our intestinal lining and our intestinal guests, if you will. Because they cohabit with us. They live with us throughout life. And it was important to try to make sure you had 80% of the bacteria in your intestinal lining was good bacteria, and 20%, 15 to 20% would be the bad bacteria. One of the things that we want to come full circle on is the conversation we had a few shows back relative to sugar. Where we talked about individuals in America consuming between 100 to 200 pounds of sugar a year, up from 20 pounds a year 20 years ago, and that the sugar becomes one of the biggest poisons in our lives. So I just want to address it from the standpoint of artificial sweeteners. So many of us are busy with the pink, the yellow, the blue packages as we go to restaurants in our homes, etc. And particularly Splendor, which has pretty much taken over the majority of the sugar market. We need to understand that these artificial sweeteners actually acidify the colon. Normal stool should be alkaline. The artificial sweeteners will make it acidy. When it makes it acidy, it makes it into a toxic environment. And a toxic environment plays havoc on your neurological system, on your memory, on your intestines relative to abdominal pain, on your energy level in terms of causing you to have these ups and downs. And you had a comment, Ken, about that. Those hypoglycemic spells that artificial sweetness was causing?
Yeah, what seems to be happening in some of the research I've read is that when your brain senses sweet, it'll cause the release of insulin. Now, artificial sweeteners do apparently cause that reaction. And when you have an outpouring of insulin because you're expecting a sugar load all of a sudden in your blood, and it's not there, then it tends to drive the blood sugar down because it tends to force it into your cells quicker. And now all of a sudden you're very hungry. So I'm not sure there's any gain at all from using artificial sweeteners because you'll tend to want to eat more that way.
Absolutely. The reality is that there is no gain. Even though it may have been approved by the FDA, at the end of the day, it's a negative, and it undermines your ability to make it to be 120 years of age. Sugar is bad enough, but artificial sweeteners are worse. So the take-home message is, if you're going to consume sugar, then I would rather use the natural sugar as opposed to the artificial sugars, because you're causing more havoc to your system when you lean towards the artificial sugars. Having said that, let's look at the subject of diabetes. We know all about type 1 and type 2 diabetes. We know that there are 30 million Americans right now with type 2 diabetes. We know there's another 30 million who are undiagnosed who are walking around with type 2 diabetes. But what about the concept of type 1A and type 3? Can you tell me something about type 1, Ken?
Type 1 is usually a juvenile type of diabetes where the onset is early in life. There's theories going around that it's caused by an autoimmune system reaction to proteins that are very similar in structure to the beta cell structure, and your body ends up attacking those. And one of the identified in literature culprit, so to speak, is cow's milk. And so some people do not digest properly, and the milk itself then becomes something that you develop an autoimmune response to in your body. Type 1A, like you infer, or type 1.5, it's sometimes called, is a later onset where it appears to be an autoimmune diabetes source, and it causes an individual to gradually need insulin. It often gets diagnosed as a type 2, but there are very specific tests that can be run to show that the difference between a type 1.5 and a type 2.
So you're saying that all type 2s aren't type 2s, that some type 2s could actually be type 1A or type 1.5.
That's right, yeah. And so there is some testing that needs to be done to clarify. It's not just simply a measure of the hemoglobin A1C like a lot of doctors use and the fasting blood sugars to indicate you have a problem. There's more testing needs to be done to isolate the two. And the approach to recovery from those is different.
So you're saying it's a different treatment?
It should be a different treatment. I had type 2 diagnosed years ago, almost 17 years now, and was able to recover, so I was no longer diabetic within a period of just a very short period of 30 days. And so I never needed anything beyond that point, no medication. And that's what I try to teach people now, coach them through the process of how to recover. And a huge culprit is white flour products. They go to sugar just like regular sugar does. A spoonful of flour gets into your system as glucose almost as fast as a spoonful of white sugar.
Okay. So is there a specific treatment for type 1A?
That treatment would, if it's an autoimmune disease, then you need to find the source of what's causing the autoimmune disease. I
see.
And it's potentially a food sensitivity or allergy, something you're ingesting in your environment that's causing this.
So that at the end of the day, if one identifies the culprit, one can actually back out of being a type 1A or type 1.5.
If there's time that you haven't sustained significant damage. So that's why it's a good diagnosis early
on before the
type
damage.
1.5 is very critical, because then you still have intact a given level of beta cells.
And I just for those who are listening, if you recall, we talked last week about the bad bacteria in the colon exacerbating an autoimmune process, an inflammatory process. And it goes back to the concept that most diseases begin in the colon. Actually, most diseases are caused by what you consume or fail to consume. But if you micromanage your bacteria, so that your bacteria is not creating an autoimmune process or an inflammation that's exacerbated autoimmune process, you're a lot further along the way. And what Ken was suggesting for those who are actually allergic to cow's milk, for example, and that cow's milk is causing the autoimmune process, and that autoimmune inflammatory process is now giving rise to what looks like diabetes. And if one goes on further with the appropriate test, identified as type 1A diabetes, that you can actually back out of that situation. You can actually recover from that situation if the tests are done early in the game. But if you wait 7, 8, 9, 10 years into it before you attempt to test for it, then you've allowed X amount of damage to occur, and it may not be able to back out. Then you simply go forth and undergo the treatment as the other type 2 diabetics are getting treated either with oral hypoglycemics or with insulin. You're listening to KLAV 1230, KLAV 1230 AM. Please call us at 702-731-1230, 702-731-1230. We'll be right back.
Just about 4 years ago, I was longboarding, hit the side of a truck. I'm sent home with the oxycodone and the Percocet. The dose milligram, it didn't change, but how often I would take them did. I wanted to stop. These withdrawal symptoms are something that I wish upon no one. I went to my doctor, Dr. Wilcox. He claimed withdrawal free. It was literally a miracle. I feel, I would say 100% better.
I'm Dr. Simmon Wilcox. I've been practicing medicine for the last 23 years. My passion has been drug and alcohol dependency, particularly methamphetamine. So what I've done in my practice, I've re-engineered how we approach the detox rejuvenation process. You go through a process where you don't feel any symptoms. My staff's priority is to ensure you're not having that discomfort.
Call 702-749-7111.
Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-749-7111. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-749-7111. Visit his office in Summerlin at 8751 Charleston, Suite 210 behind Fleming Steakhouse. Call Dr. Wilcox at 702-749-7111.
Do you know that 60% of the healthcare dollars spent over the next 10 years will be spent on stem cells or a stem cell related process? Listen in as we define for you how medicine will change your life and the life of those who you love over the next 10 to 15 years.
Covering the issues that matter and adding years to your life. Longevity with Dr. Wilcox. Monday and Thursday morning at 10. Only here on KLAV. Longevity with Dr. Wilcox continues. Here again, your host, Dr. Simmon Wilcox.
We're back, and just want to give a shout out to Joyce, who called last week and had some questions about alternative medicine treatments for cataracts, and we do have some answers for you. She's going to come in, and we're going to review those with her. Just want to say on the topic we was talking about at the close of the last 15 minutes on the issue of type 1 and type 2 diabetes. Remember, I am a stem cell fellow. There are a number of treatments available now through various institutions for type 1 and type 2 diabetes when it comes to stem cells and the stem cells' ability to essentially correct that issue. We serve as a referral resource for those institutions and for those individuals who have that technology. We do not have that technology in our office, but there are individuals down in Florida, there are individuals in Cleveland who do have the technology to address the type 1 and type 2 diabetes and to help you remove that through stem cells. Remember, when we use stem cells, that they are what we call progenitor cells. They're cells you walk around with your body that have never differentiated. They've multiplied, but they've never differentiated, and they're cells that, with the proper manipulation, can be manipulated into pancreatic cells, beta cells, insulin cells, and can help one overcome their type 1 and type 2 diabetes. I expect that to be commonplace in the next 10 years, but right now there are only certain places in the country you can go to have those issues addressed. And the question is always asked, does insurance cover it? For the most part, they do not. There are some small segments of it that they would cover, maybe 25% of it. But for those who have that interest and have that concern, if you come to us, we will do an evaluation of what your issue happens to be, whether it's type 1, type 1A, type 2, or type 3 diabetes that we're going to talk about here in a second, and then determine where you would go and which stem cell experts around the country has the ability to address that for you. Ken, just tell me type 3 diabetes. That's a new term even for me. Tell me about type 3 diabetes.
There is some discussion in literature now about a type 3 diabetes related to Alzheimer's. In discussions I've seen, the vector is that the brain is just oversaturated with sugars and flour products, particularly the ones that are refined and processed. And like other parts of the body, the brain cells start becoming insulin resistive, which means the receptors no longer allow sugar in, and sometimes the cells try to protect themselves by not allowing too much sugar in. And they become resistive, and after a while, they tend to start starving because they're now in a place where it's hard to get insulin to turn on the gate to allow the sugar in. And so in that method, the approach is, that I've seen up to date, is to try to get the brain cells to start operating in a Krebs cycle. And there is some recovery that can happen over time, but get them operating in a cycle where they convert fat, and it needs to be the right type of fat, into the source of energy for their cells, and functions start coming back.
Okay, I was afraid you're going to start telling me about the Krebs cycle. I said, no, don't do that on air. Krebs cycle's a little too complicated here.
Yeah.
Okay, but that's fine.
What it is, it's a way that the body can start processing fat as energy instead of just sugar as energy.
Okay. So when individuals looking at Alzheimer's now, one of the ways they're looking at it is that this may actually be another form of diabetes.
It could present as a form of diabetes. There's some other things that can influence it. If you have blood cells that are starting to become clogged, so the arteries are starting to become clogged as they thin out, this can also starve portions of the brain. It can also promote mini strokes because they're no longer as big a pathway as they once were, and the mini strokes can cause progressive damage.
Alzheimer's. Okay.
And so those all steal functions from the brain, and there's different ways of overcoming different types of problems. Another one is the type of fats we've been ingesting for many, many years, or the hydrogenated or trans fats, make the cell membranes.
The bad fats.
Bad fats. They make them very resistive for the normal functions of the cells. They actually change the voltage potential in the cell. Hard to get insulin to turn on the gates to allow the right amount of glucose into them.
There you go, talking scientific again.
Voltage
potential of the cells. So, I understand Ken is an engineer as part of his scientific training. When you say voltage potential of the cells, you mean it makes it harder because everything we have electronic bodies.
Yes.
And everything that happens to us, and I've said this before in the air, is actually a chemical reaction. It's actually an electrical reaction. And one of those electrical reactions is the transport of nutrients across a cell wall.
Yes.
That's an electrical event. And so what Ken is saying, if I can speak for you for a moment, is that electrical event becomes much more difficult, requires additional voltage to occur as a result of that pathology. Mm-hmm. But we are electrical creatures, and everything we do at the end of the day happens to be an electrical reaction. And so one way to look at the whole body and look at every disease process is to look at it from the standpoint of what is happening with the electricity at the cellular level on a particular disease process or in a particular organ.
You know, the chemical reactions are often electronic attraction reactions. And so you get these throughout the body. And one of the things that these bad fats have caused over the years is disruption of the membrane. Mm-hmm. And you have to get these fats as the cell dies. You want to remove those fats, put the right type of omega-3, omega-6 balance in to replace the trans fats. But your body is very efficient. It will tend to reabsorb those bad fats in the colon unless you got a very heavy fiber load.
I see.
And so you want to have 3 meals a day, 3 stools a day minimum. You want to about at least double the amount of fiber, then right type of fiber than the government recommends. It will pull those bad oils out through that method, and then your body does recover over time.
Exactly. And as we spoke before, that those bad bacteria tend to absorb those bad fats and become toxic and create a problem again. Reverting back to the intestinal lining, your intestinal colon, the intestinal environment, wanting to protect that, wanting to micromanage that particular environment. Any recommendations other than the high fiber for those who happen to be diabetic or those who don't want to become a diabetic that they should be avoiding?
The avoidance of as much processed grain as possible.
Processed
grain.
What's an example of processed?
Those
grain?
Pastas and spaghettis, cakes, cookies, breads, everything that people absolutely love, got used to eating.
All the happy foods.
Yeah, and it's tough initially, but once you get rid of the sugar cravings, and sometimes that's caused by yeast overgrowth, from too many prescriptions of antibiotics.
Okay.
And not enough probiotics after you go through that cycle, you'll get a severe cravings for sugar and flour, because flour turns to a glucose. And so you need to slowly wean yourself off. If you've got fungus overgrowth, that can be identified, and then there's ways of killing it and removing the toxins.
And I think it's important to underline the word slowly. Individuals try to do it overnight and it doesn't work because your body needs an adjustment period. So I tell patients to titrate yourself down, and you titrate yourself by maybe eliminating 1 or 2 different food items you've eaten over the years that you eat every day, but don't change it overnight because you don't want to shock your body, and you want not to have a failure. And to have it done successfully, what you want to do is pick 1 or 2 items, whether it's deleting that Coca-Cola, was deleting that extra bread you're doing during lunch, but slowly back your way out of the bad choices you've made, even though they may be happy choices. You slowly back your way out of those, and you do it gradually over a period of 6 or 7 weeks. You find yourself with a whole new set of food products that you're consuming. Now, that's easy for me to say. It's a lot harder for a mother who's cooking for a family of 5 and a husband, and the mother wants to do it, but the other 5 and the husband have their own agenda. And they're looking at, what are you doing to our food? We want our food back. So I understand that politically it may not be easy to do. So each one of us, and given our family structures, given our family attitude, given the politics of food in your household and your family, have to decide, how do we make this approach without creating havoc, without causing World War II and World War III in our households relative to the change in what we put on the table for breakfast, for lunch, for dinner. And that's a process. It's a process each one of us has to decide, how do we get there? How do we make it through that struggle? And how do we make a difference in the life of those who we claim to love? You're listening to KLAV 1230, KLAV 1230 AM, KLAV 1230 AM. Please call us at 702-731-1230, 702-731-1230. We'll be right back. Do you know that 60% of the healthcare dollars spent over the next 10 years will be spent on stem cells or a stem cell related process? Listen in as we define for you how medicine will change your life and the life of those who you love over the next 10 to 15 years.
Covering the issues that matter and adding years to your life. Longevity with Dr. Wilcox. Monday and Thursday morning at 10. Only here on KLAV.
Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-749-7111. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-749-7111. Visit his office in Summerlin at 8751 Charleston, Suite 210 behind Fleming Steakhouse. Call Dr. Wilcox at 702-749-7111.
Hello, my name is Dr. Simmon Wilcox. I'm a board-certified physician in family medicine. I have 20 years experience with drug and alcohol abuse and treatment thereof. I bring to you a new service at my facility. We're asking you to examine your household, your family, your community, and decide if there's someone there who needs what we have to offer.
Give Dr. Simmon Wilcox a call today at 702-749-7111.
Do you know that 60% of the healthcare dollars spent over the next 10 years will be spent on stem cells or a stem cell-related process? Listen in as we define for you how medicine will change your life and the life of those who you love over the next 10 to 15 years.
Covering the issues that matter and adding years to your life. Longevity with Dr. Wilcox. Monday and Thursday morning at 10. Only here on KLAV.
Just about 4 years ago, I was longboarding, hit the side of a truck. I'm sent home with the oxycodone and the Percocet. The dose milligram, it didn't change, but how often I would take them did. I wanted to stop. These withdrawal symptoms are something that I wish upon no one. I went to my doctor, Dr. Wilcox. He claimed withdrawal free. It was literally a miracle. I feel, I would say 100% better.
I'm Dr. Simmon Wilcox. I've been practicing medicine for the last 23 years. My passion has been drug and alcohol dependency, particularly methamphetamine. So what I've done in my practice, I've re-engineered how we approach the detox rejuvenation process. You go through a process where you don't feel any symptoms. My staff's priority is to ensure you're not having that discomfort.
Call 702-749-7111.
You're listening to Longevity with Dr. Wilcox. The phone lines are open at 731-1230. Now, here again, your host, Dr. Wilcox.
JR, during the break, there was a call that came in.
Yeah, Doc, the person was asking and interested in Alzheimer's and Parkinson's disease. Is there anything that we can do to attack that or to direct that?
Well, some of that Ken actually addressed in our last segment, but let me say that in our office, what we do is we take our patients with Alzheimer's and with Parkinson's and even with dementia. We take them off all the artificial sugars because we understand that artificial sweeteners are toxic to the brain. And there's no way to turn your loved one around who happens to have the beginnings of dementia, or the beginnings of Parkinson, or end stage. There's no way to turn them around if you don't take them off the artificial sweeteners. So that's the first thing we do.
Okay.
Stop the artificial sweeteners.
Beautiful.
The second
Simple.
thing I do is to take them off the nitrates. So all these lunch meats, etc., with nitrates, got to go.
Nitrates, explain to me a little bit more about the nitrates, Doc. What more do I consume in my diet that has nitrates?
What else do we have there, Ken, in terms of the nitrates?
Hot dogs or any of the preserved
It's a nitrate
meats.
bomb, right?
Oh, Lord. Any of the preserved meats generally are preserved through a nitrate. I know I have to be very selective if I eat any pork.
Exactly.
They tend to, it's a way of killing bacteria.
Yes.
The problem is you got some very good friendly bacteria in your system. You don't want to kill them off.
Mm-hmm.
So I tend to avoid anything that has a nitrate in it.
So nitrates have to go.
Okay.
One of the last patients we treated with Parkinson's up in St. George was a butcher who always was around nitrates, and that was kind of what he did, and he absorbed a lot of it.
Wow.
And he has Parkinson's. Was able to turn him around, give him a 70% improvement by adjusting his diet, no sweeteners, off the nitrates, and then we fixed their hormones.
Right.
Even in a 75, 80-year-old guy, or female, the testosterone's low, so we fixed the testosterone because you need that for energy, you need that for muscle strength, you need that for mental agility. So we fixed their hormones, draw the blood level, check it out, and then we prescribe it. Some people think that an 80-year-old male or female wouldn't need to have hormonal adjustments, but they do. If you want them to get to be 100, 115, 120, we need to fix the bathwater, fix the bathwater, fix the bathwater, fix what your brain and your heart and your lungs and your liver is floating in every day. you got to fix it. So you got to fix that toxicity if you want to see a change occur externally. You got to fix the internal toxicity that your loved ones are walking around with. So fix the bathwater. So we fix the bathwater by getting rid of the nitrates. We fix the bathwater by getting rid of the artificial sweeteners. We fix the bathwater by giving them the hormonal adjustment that's required. On top of that, and you've heard us say it so many times, but Patricia King, Kane, who trained me on this 15 years ago, says this all the time, is that if you give them intravenous omegas and intravenous glutathione, it addresses half of all the neurological diseases out there. So on all patients with dementia, with Alzheimer's, with ALS, with Parkinson's, we give them the intravenous omegas and intravenous glutathione. And as Ken suggested earlier when we talked about the cellular voltage, I think it was the terminology he used, our bodies are electric. And what we're doing when we give the omegas, we are going in and we're repairing not only the cell membrane, because that's what the cell membranes are made of, all those omegas, the right combination of omega-3s, omega-6s, but also when you, and I always use the example, if you look at an extension cord, the extension cord has insulation. Our nerves has insulation. That insulation is called myelin. That myelin is made up of omegas. So we're going in, we're repairing the nerves, okay, and we're repairing the cell membrane. And so that's all part of the constellation of treatments that we offer, that we package together, that we micromanage on those individuals who are struggling with dementia, those who are struggling with Parkinson's, those who are struggling with ALS, those who are struggling with Lou Gehrig's disease. We bring that to the table, but we've got to fix what you consume. And my pet peeve, I said this before, you put these patients in a hospital, and what do? We put artificial sweeteners on the tray. We send nitrates up to the bedside for them to eat. And I walk into the patient to see them, and I look at what they're eating. I say, this is not right. that we can't make progress when we're feeding them the wrong food, and just that connection hasn't sunk in yet in America. That we've got to change what we feed these patients who are coming into looking to us as healers to heal them, and at the same time we're letting a certain department deliver items to the bedside that's undermining the process. And so it's going to take the families to stand up and shout, just say foul, out of bounds, that something's got to change, time out. We need to look at this again, and not allow systems and institutions, including school systems, to feed our loved ones things that are going to be toxic, that's undermining the quality and the makeup of the bath water in their bodies, that serum, what our minds and our eyes and our liver and our lungs are floating in. Yes,
Doc, as we go on, we're talking about this, and we're talking about these serious diseases and these things in our brains or in our mind, our makeup. You know me, I'm a little radical, so you got to calm me down a little bit once in a while. We'll talk about docs.
I always have to calm you down.
And the medical institution and American Medical Association. Not that, we all need doctors, we need it, and they know what they know, but why they spend billions of dollars on cures, a.k.a. cures for Alzheimer's, cures for Parkinson's, cures for this, billions of dollars, but we don't have anything. And what do they spend on preventing? They know what causes it, but they don't spend anything on preventative. So what my question to you is this, after I've got that off my chest, is...
I'm glad you feel better.
Thank God I don't have any Parkinson's, I know of, or anything, or dementia or anything. A little dementia here and there, but
okay.
But what this, and I know this answer, but I'm going to ask this for the listeners.
Okay.
I'm healthy, somewhat healthy. Abuse myself a little bit here and there, eat bad here and there, but I'm trying to eat healthy. But all the treatments, the omegas, the glutathione, the Myers cocktails, it's made a big difference in how I feel and how I recall things for myself without the diseases. So my question is, does this help the people that doesn't have Parkinson's today or doesn't have Alzheimer's that it may prevent?
It does, and first of all, I saw you at Whole Foods this morning, and you were eating right, and I applauded you on that.
Thank you.
And what your selection was this morning. So you're actually listening to the show. So I'm impressed. I know one person's listening. But you asked a rhetorical question that you knew the answer to. But yes, it does help individuals who have not developed Parkinson's, who have not developed dementia, who have not developed Alzheimer's, who have not felt the sense of aging. Many of us at 25 and 30, and some of us 40, are still feeling invincible. We haven't been faced with the sense of our own immortality. We just haven't. It hasn't slapped us in the face yet. I have to say, though, that for myself personally, and I'm 57 now, when Patricia King taught me about the treatments, intravenous glutathione, intravenous omegas, she taught me that almost 17 years ago, that I've been giving them to myself, or have my staff give it to myself, every couple of weeks for a number of years, for over 15, 16 years since I learned the process, because I've been very nervous for a long time about developing dementia, about developing Parkinson's, and I'm the guy who want to live to be 120, and I think I can get there. I think I can take other patients there, but I can't talk the talk if I don't walk the walk. So I do consume it. I take the intravenous, even though there's nothing wrong with me. And often I wake up every morning and say I'm taking collectively 12 or 13 items a day, and there's nothing wrong with me. If I look at all the stuff I take orally, I look at all the things I administer intravenously, but I have to prove to myself that it can be done, and I'm a believer that we can make it through, that we need to understand how do we back into diseases, how do we eat ourselves into death, and once we understand that, we can start taking control of not only just our lives, but the lives of people who we love. And the lives of people who we want to have with us on that journey. And it's doable, and it's not a very expensive way if we can get conscious of the fact that it can be done, that we have to buy into it at a conscious level, that we need to be empowered with information. I hope this radio show is empowering individuals with information so they can make decisions and choices. Yeah. Because at the end of the day, you can't make a good choice if you don't have the information.
That's true.
And what we're trying to deliver is information that is digestible, information that you can become empowered with, information that you can say, aha, I can go out today and buy something different and make a difference in the quality of my life, my physical body and my children's body this afternoon by making a different choice at the grocery store. And that's all we're trying to lead people to be able to do.
And you know what I seem to, analyze this with is we're all driving around a Ferrari. We're all in a Ferrari, our bodies, because to repair it, it's astronomical costs. Mm-hmm. And it's about responding instead of reacting. And the human race, and myself included, is a reactor a lot of times. When you learn to respond, we respond to our body's call instead of react when it's too late. When it's too late, the costs are exponential.
But part of the problem, and to finish answering your earlier question in terms of why we spend so much money on the cure and not prevention, is that the funds are coming from various pharmaceutical companies.
Right.
And the money is in the treatment of the disease. The money is in fixing the broken down car. That's why our automobile manufacturers don't make cars that last forever, because they will make no money. They need to be able to sell the parts. And they need to be able to make the money in repairs. At the same time, there's no one out there at an institutional standpoint who is feeding cash into medical schools to figure out the prevention. All the cash is being fed in to figure out the fix on the backside once it's broken. And it requires a different paradigm in terms of how we approach education, in terms of how we accept funds from individuals that are now controlling and influencing politically and academically what our future doctors are learning. So that's going to require an entire paradigm change that is going to need to occur. We're listening to KLAV 1230, KLAV 1230 AM. Please call us at 731-1230, 731-1230.
We'll be right back.
Hello, my name is Dr. Simmon Wilcox. I'm a board-certified physician in family medicine. I have 20 years' experience with drug and alcohol abuse and treatment thereof. I bring to you a new service at my facility. We're asking you to examine your household, your family, your community and decide if there's someone there who needs what we have to offer.
Give Dr. Simmon Wilcox a call today at 702-749-7111.
Do you know that 60% of the healthcare dollars spent over the next 10 years will be spent on stem cells or a stem cell related process? Listen in as we define for you how medicine will change your life and the life of those who you love over the next 10 to 15 years.
Covering the issues that matter and adding years to your life. Longevity with Dr. Wilcox. Monday and Thursday morning at 10. Only here on KLAV.
Are you having difficulty detoxing from drugs or medication? Let Dr. Wilcox help you. Call at 702-749-7111. His revolutionary detoxing program is designed to help you detox without the discomfort of other procedures. Call him at 702-749-7111. Visit his office in Summerlin at 8751 Charleston, Suite 210 behind Fleming Steakhouse. Call Dr. Wilcox at 702-749-7111.
Just about 4 years ago, I was longboarding, hit the side of a truck. I'm sent home with the oxycodone and the Percocet. The dose milligram, it didn't change, but how often I would take them did. I wanted to stop. These withdrawal symptoms are something that I wish upon no one. I went to my doctor, Dr. Wilcox. He claimed withdrawal free. It was literally a miracle. I feel, I would say 100% better.
I'm Dr. Simmon Wilcox. I've been practicing medicine for the last 23 years. My passion has been drug and alcohol dependency, particularly methamphetamine. So what I've done in my practice, I've re-engineered how we approach the detox rejuvenation process. You go through a process where you don't feel any symptoms. My staff's priority is to ensure you're not having that discomfort.
Call 702-749-7111.
Today is the first day of the rest of your life. This is Longevity with Dr. Wilcox.
During the break, we had an interesting discussion. I just want Ken to fill us in on that. As I talked about treatments for the dementia, the Parkinson's, the Alzheimer's, I forgot to mention the fact that we do give out the vitamin B12, but there's some other vitamins there that we should be looking at, making sure our older individuals, those over 50, I'm 57, that we should also be consuming. Can you tell us about that, Ken?
You know, the stomach tends to change. Our body changes a lot at 50 of how we process foods and nutrients, and B12 is processed by one chemical produced by the stomach so that you can absorb it. So after 50, every year you get less and less ability to absorb that out of meat and out of vitamin pills when you take them directly through your digestive tract.
So you need to supplement.
You need to supplement under the tongue. Sublingual B12 is a great way to get it. And getting Dr. Wilcox to give you the B12 shots is another way.
Okay.
But in addition to that, folic acid is primarily used in vitamin pills. It's a cheap form of folate, which is a vitamin. But after 50, it tends to get in your body less and less. So you want folate actually available now as supplements to help satisfy that. It helps protect the nerves in the brain. And then the other one is the B6. And then you want to increase that also. So some places offer a sublingual B12, B6, and folate combined.
Exactly. And we actually at our office give you the injection, but then we give you a prescription so you can give yourself the injection. And we don't mind seeing you every week if you want to come see us, but it would be a lot more economical for you to give yourself your own shots. And then we can see you once every 4 months and refill the prescription for you to give the B12 shots. We've talked about folate earlier on previous shows as it relates to females and trying to decrease the event of neurological diseases in pregnancy. So you need to take folic there, at least 1 milligram a day for any potential childbearing female out there. But now for those who are over 50, like myself, who may not be processing the vitamins as well, we need that extra supplement for the B12, the folic, and B6. Thank you for that, Ken. I just want to, as we come to the bottom half of the show, just want to shift gears and look at the issue of iodine, because iodine has been taken out of our diet is taken out of the salt, and they were concerned about the effects relative to the thyroid. But they're, at the end of the day, iodine actually has a number of positive medical consequences. We end up often actually prescribing iodine back into the diets of many of our clients, and we just actually give them prescription for the iodine. You take it in a liquid format, and the potassium iodine. Tell us a little bit, Ken, about potassium iodine, the kinds of things that we could benefit from by consuming potassium iodine.
Yeah, some of the literature I've seen discusses when an old cell dies, it's going to replicate itself. To help it die, it needs some iodine. And
to help it die, it needs some iodine. Okay.
Yeah, because otherwise it's going
that.
to cell that won't die, and you know what that is.
Oh, I see. You've seen those cells that will transform into cancers.
Yes.
When the death cycle is not completed, but the DNA has now been deranged, they actually continue to linger and become cancerous. So you need the iodine for what?
It helps the RNA in the old cell to kill the old cell.
Okay.
And that's what I've seen in some literature. There's always some controversy, but
and the listeners don't have to remember that, but it helps the RNA. Which is related to your DNA. It helps your RNA actually get absorbed with the iodine and to help the cell to die. So we need to modulate apoptosis, which is something called cell death. We need to modulate the death of the cells. We need to help that occur in a more natural way by having the iodine on board. In the absence of the iodine, the cell doesn't die on time. It lingers in a way that has been mutilated because it's half dead but not all the way there, and therefore then it sets you up for the development of these abnormal cells, which we've learned to call cancers. Okay. Anything else that iodine does for us?
Well, iodine it helps eliminate breast cyst, ovarian cyst, ganglion, and sebaceous cyst.
And I've seen female patients of mine with breast cysts, and actually at times painful breast cysts, who we were given oral iodine to, and then over a period of 4 to 5, 6 weeks, they reported decrease in that amount of pain.
Yeah.
So you say that it does help regulate those type of masses in the body.
Right, and it's often prescribed potassium iodide saturated solution, which means 100% there. It's a prescription. You can also get it at 50%, which I do over the counter. But it will, when your body gets enough iodine, it tends to excrete excess iodine in your lung membranes and your sinus membranes. So it's used to get rid of stubborn infections often in those areas.
A lot of my patients with COPD and asthma and who have a lot of mucus, we give something called SSKI.
Yes.
And SSKI is kind of old school, but it's iodine. It's iodine. You take it in drops, and I would tell them to take 10 drops of it and drink it every 3 to 4 hours. And tremendous response in the ability to loosen the mucus and to expectorate that mucus and improve the ability to breathe. Because remember, those airways are clogged. Those asthmatics, those COPDers, with those areas are tubes. And as you put glue in the tubes, it's going to be hard for air to move around. It kind of clogs it. And that mucus, it plugs the airways, plugs the tubes, now loosen up with the iodine. So it really does make a difference. The insurance may or may not cover it. Like for some patients with SSKI, it's written as a prescription. It covers it. For other patients, it won't. But either way, from a health standpoint, it's something you need if you're going to micromanage how your body behaves as it ages.
And it also tends to get rid of excess calcium, and that's important in your vascular health. I had a friend a few years back who was facing bypass surgery.
Okay.
And he could no longer walk up a flight of steps. I said, read this article. He did. And I told him, if you want to take it, I'll buy the material for you. And he said, okay. And he was supposed to go in for bypass in 6 weeks. And they were going to do a scan, find out which arteries need replaced, and do the operation.
Okay.
And since he couldn't walk up a flight of steps as we started, he took 10 drops a day of the 50% solution, and at the end of 3 weeks, he was walking up 3 flights of steps. He kept on taking it, just 10 drops a day, and then at the end of 6 weeks, when they did the scan before the operation, there was no narrowing of his arteries in his heart anywhere, so they kicked him out of surgery.
Wow.
It was close to $80,000 for a $10 bottle, so a little trade-off.
Well, congratulations, Ken. And for the record, Ken is not an MD. Ken is a research scientist. But I guess he took the opportunity to help out a friend with some non-prescription medication, and he's given us his report of how that event turned out. So it's very, very, very interesting.
Yeah.
I like that story.
You always ask people to do their own research. I just point them where to go look.
Well, it goes back to empowering individuals with information so they can make the right choices. But these are simple, low-lying grapes. These are things that are easy for them to modify, particularly when you look at things like iodine. So many patients, one thing most of my patients still have not really absorbed the concept of it is the need to consume the iodine. They're figuring out the B12. They're figuring out the omegas. They're listening to me when I say folic acid. They're even buying into the intravenous omegas, intravenous glutathione, but somehow the iodine concept just hasn't seemed to settle in yet. And I find myself repeating it because the individuals saying, well, doc, I feel good. Why do I need to do this? It's because if you got a Ferrari, as JR said earlier, you want to keep the Ferrari running fine-tuned on the front side of life and not wait till the Ferrari breaks down and then you try to fix it when it's terribly expensive. Mm-hmm. So we're trying to move you to a level of consciousness that says, how do I keep my body performing at optimum for the longest period of time, as opposed to waiting until that dashboard light comes on that says warning. You need a repair. And there are ways to do that in very simple ways. And one of the things we need to adjust as we look at this is the iodine issue. So it would be 10% iodine?
Well, I use 50%.
50% iodine.
But there's always caution. Some people are allergic to iodine.
Uh-huh.
They tend to be people who are allergic to shellfish.
Oh, exactly.
So you always have, if you try it, do your own research, try it, then you need to make sure you feel better, not worse.
And then you talk to the doctor, make sure the doctor feels like there's not going to be a conflict. I actually use 100% iodine in my practice, but if they can't get 100%, then 50%, and they just take additional amount. But usually in between 5 to 10 drops a day is what they take. And I see JR with a gleam in his eye.
This a little light hit me in the head for a second. And Ken, I just want to ask you a question. How old are you?
74 this month.
Congratulations.
God bless you. You look great.
How many medications are you on?
None. I
None?
don't.
Zero
normal
medications?
pharmaceuticals I try not to do. If I need an antibiotic, I'll get an antibiotic.
Are you healthy?
Yeah, I can still run up steps and do all that. I still can do 12-hour days, 14-hour days, no problem.
Beautiful. Yeah, you're a hardworking man. I know that. I've known you for some time now, and you have a great energy. But I just wanted to ask that in response for the listeners as well, because I already know the answers to those questions. But it helps to, maybe they'll help to receive what you're speaking to them a little bit, because you are walking the walk, walking your talk as well. So that's why I wanted to throw that out there, everybody.
Very good. Thank you for raising that, JR. JR, as most of you have come to know, is a radical guy on the show who has a different perception of life and medicine. He asked me this morning to talk about doctors being the third leading cause of death, and I said, I'm not going to talk about that, JR. but on the next show, we're going to review the JAMA article.
Yeah.
And the lead title on that article was "Doctors Are the Third Leading Cause of Death," and we're going to talk about why the doctors wrote and approved this particular journal cool. in honor of JR's request. Again, thank you for listening. You are listening to KLAV 12:30 a.m. KLAV 12:30 a.m. Please call us next week at 731-1230. Feel free to visit us behind Fleming's Restaurant next to Whole Foods on the second floor there. Again, you've been listening to Longevity with Dr. Wilcox. I'd like to thank Ken Baker for coming today, sharing his expertise as a research scientist.